Nearly 1,000 people are already dead in this country from swine flu over the last 2 months. 875 is the exact total. The figures, though, are getting alarming by the day. In the national capital, only 8 dead. But there's a more sinister problem here. As our correspondent Jugal Purohit finds out, some of the more prestigious government hospitals marked out for the swine flu fight are massively overburdened. So before we go to the other states, let's turn to Delhi, where panic is slowly setting in.
With 8 people dead since January, Delhi happens to be one of the least affected in the national spread of swine flu. But the city's hospitals are straining under a big weight. The government-run hospital, key to the fight back, is simply overburdened. Many of the 2,456 infected patients in Delhi are treated here. But as the virus spreads, citizens from neighboring states have no choice but to crowd into the capital for treatment. Fear of the virus nearly as infectious now, like in the case of this family from Jhansi, who were concerned enough to bring their sick son all the way by train, only to be told he didn't have swine flu.
सरकार की तरफ से इस बारे में अभी तक झांसी में कोई कदम नहीं उठाया गया, वरना ये जांच अगर वहां हो जाती तो हम इतना परेशान थोड़ी ना होते। वहां डॉक्टर ने कह दिया सस्पेक्टेड है कि स्वाइन फ्लू है। उस कंडीशन में हम लोग कैसे यहाँ बच्चे को लेके आए वो तो एक पेरेंट्स ही समझ सकते हैं।
Perhaps bigger than the threat of swine flu is the panic that has set in on account of this illness. On my right is a family which has had to make a journey of 442 kilometers between Jhansi to New Delhi, only to be told that they need not have travelled at all. The boy who you see on your screen is suffering from typhoid. However, owing to the lack of clarity and facilities in Jhansi, the doctors there, both in the private sector as well as in the public sector, are seeking refuge in referring patients to centres like New Delhi.
Delhi's swine flu figures may be among the lowest among the nearly 1,000 people dead across the country. But for a capital city, major concerns remain. With Jugal Purohit in Delhi, Bureau Report, Headlines Today.
Is spreading right across the country. Let's just take a look at just how deep-rooted the problem. It started, remember, in Andhra Pradesh way back in December, but now it's spread to several parts of the country. Rajasthan, worst affected, 240 deaths, along with Gujarat, 242, where Section 144 is now imposed in Ahmedabad. Maharashtra, 112 deaths. So central and western India very badly affected, but it's even spread to the north, to Jammu and Kashmir, where 5 deaths have now been reported, to Uttarakhand, where 3 deaths have now been reported. Odisha, 3 deaths have been reported. West Bengal, 5 deaths are being reported. These are all official figures, of course, at the moment. So clearly, the outbreak now is reaching to every corner of the country. Take a look as our reporters go to hospitals to find out just how bad the situation is.
Around 7 people have already died because of H1N1 in Kashmir alone, and more than 150 cases have so far been tested positive, and the number seems to be increasing every single day.
पहले से इंतजाम करना चाहिए था और लोगों में डर नहीं होता।
इस चीज की तैयारी करना चाहिए पहले से, लेकिन बेखबर रहा लोग, तो अब पता चला यहाँ पे बीमारी फैले हुए, घर से नहीं निकलते आजकल।
Following the State Health Minister's instruction, BMC is conducting an audit on all the swine flu deaths in the city to understand the disease pattern and the mortality in their perspective. The report would be submitted to State Health Ministry once again for the further action.
All across Rajasthan, more than 5,000 people have been tested positive. Not only this, 9 doctors treating swine flu patients have also been tested positive. There is a shortage of, whether it be vaccines, be it the masks, and also an essential medicine used to treat swine flu. Tamiflu is also, there's a shortage of Tamiflu as well. This is Manisha Meheldar reporting from Jodhpur for Headlines Today.
The swine flu epidemic spreading across the country. Is the public health system in a crisis? The big question that we are going to be raising tonight. Joining me first, is someone who I spoke to a short while ago. Dr. Jagdish Prasad is the Director General of Health Services in the country. I began by asking him that the Health Minister in Parliament saying today, no need to panic. But sir, with 875 deaths, over 14,000 affected, is it not time, Dr. Prasad, to worry about what's happening?
See, it is correct, nothing to get panic when about this H1N1. Only thing that people has to take precautions. And if they get treatment at earlier stage, then nothing will happen. Whatever the death has occurred is because the patient is coming not only in third stage, when already the lung is damaged and the patient needs the ventilatory supports. That type of patient only we have lost. I can tell you that if patients have come in the when in 1, 2 or 3 stage, patient has been able to survive. But if they come only when the lung is damaged, then it becomes difficult. Then it depends upon the biology of the patient, but we have to give the life support to the such type of patients. Because that is why I want to give the message to all the public that if you have a running nose and if you have a fever, you must consult the doctors. And doctor, I want to tell that if there is a high suspicion of H1N1 infections, put on the treatment. If you are sending the home, prophylactically, you must give the drugs, 1 tablet, also the person who come in contact with you.
You know, Dr. Prasad, you are making it out to be like the minister, there is nothing to worry about. The fact is, the minister today says in Parliament, medicines and facilities are in place to tackle the disease. Headlines today has carried out status checks in Delhi, Rajasthan, other states where the systems are far from being in place. Are you all giving empty assurances to the country at the moment when you say there is no need to panic?
See, I cannot comment upon the states at the moment, but I can tell you that whatever the state is asking from us, we are giving them, and we have enough stock of everything. So I have no comment on the states, what you have seen, because our secretary is talking to the state every day, asking them any problem is there or not. Today only the Gujarat asked vaccine from us. We have sent 15,000 vaccines. So what is the ground status in the states? Whatever we are giving the feedback from the state, we have to follow it.
My problem here, Dr. Prasad, is the manner in which this is being played out. The government, it appears, is waking up suddenly. Suddenly, the Gujarat government, for example, has invoked Section 144 in Ahmedabad, prohibiting mass gatherings. Surely, at one level, you say don't panic, and there you have Section 144 being imposed. I mean, I'm not being able to reconcile. What does the government say? Is swine flu now a situation which we should be worried about to the extent of 144 being imposed?
See, mass gathering is definitely not a solution, but question is that people should be alert that if you have a running nose, if you have a fever, please don't go to the mass. Don't go to the place like a market. Don't go to the place where there is lots of people are standing.
Okay, there you have the Director General Health Services saying, be alert, don't panic. That's the message you're giving, Dr. Prasad. The question though, and I want to now take it to top doctors as well as those who are dealing with it at a public policy level, how is all this playing out at the moment? At the moment, joining me now is Dr. Sanjeev Bagai. He joins me from the, he's a private practitioner and Vice Chairman and Director of the Manipal Hospital. Dr. Devi Shetty, Chairman and Founder of the Narayan Hridayalaya, is also joining us. Ami Yagnik, spokesperson of the Congress, and Dr. Sanjay Jaiswal, BJP member of the governing body also of the All India Institute of Medical Sciences. Appreciate all of you joining us here at this moment. Devi Shetty, let me come to you here. Do you believe that the situation is such that we shouldn't panic? 875 people dead, 14,000 cases being reported. Is the government of the day living in denial when they say we shouldn't panic?
Rajdeep, I agree with the government for once that there is no need to panic. I just want to let you know that in US, which is only 25% of our size, every year due to common cold, just flu, nearly 90,000 people die. So I'm not saying, you know, those 900 or 1,000 people who died, I have all the sympathy for them, but please do not create a panic. The swine flu, not that everyone who gets are going to die, and there are various people who are vulnerable, but what is important is people should be aware that by sneezing and cold and cough, and these people interacting with large number of people, if they have a swine flu, they can infect others. Like schools, I am very upset with some of the schools who are telling the parents that if a child has a cold and cough, still send him to school. Only if he has fever, don't send him. It is very important, especially in winter season when there is swine flu breakout, if somebody has cold and cough, they should avoid themselves exposing themselves to the public. Other than that, there is nothing one can do or nothing government can do. I agree that there has to be vaccines available, tablets available, but these are of limited value to only vulnerable people. Not that the whole 1.2 billion population should get themselves vaccinated. So essentially there is more panic than the disease.
You're saying there is more, and there is no need to panic. You believe that the government in that sense is sending out the right message. Dr. Bagai, do you also believe the government is sending out the right message? Because the government says don't panic, the Gujarat government goes and imposes section 144. How are we to reconcile these two situations? Clearly, someone in government is panicking because there's a former minister in Gujarat who's now contracted swine flu, and there are the moment the minister has contracted swine flu, suddenly the government believes there's a situation to panic about, goes and imposes section 144.
Okay, I'll just take a minute to explain. H1N1, as it is called as swine flu, is a common influenza virus. One of the many influenza viruses, which is called as type A influenza virus. This virus keeps mutating itself, and at the present moment it is actually H3N2 and not H1N1 as everyone has caught on to. It's a self-limiting infection. It lasts in the body for 5 to 7 days, and 99.9% of the time it goes away even without taking paracetamol. That means the infection is subclinical, it is sublatent. Yes, there have been deaths, but if you look at the statistical analysis, the largest number of deaths in H1N1 infection are of those patients who already have comorbid diseases. Now, if you consider a group of H1N1 versus common influenza, and third group as any other disease, the number of patients which die of any other disease or of common influenza are far more than H1N1. With regards a panic situation, I think there is a fear. We see lots and lots of patients which come to us every day asking either for the vaccines or asking us prophylactically of this drug known as Tamiflu. I must advise that a vaccine is recommended in patients of a high index group which are more vulnerable, and Tamiflu is not used for mass prophylaxis. The other indication of Tamiflu which people must keep in mind is it is only useful if it is used in the first 2 days of onset of symptoms. Very often patients come to a doctor after 2 days or 3 days. So what my message really is, do not treat a patient at home. If a patient has fever, cold, cough, let the local doctor see the patient and then decide what medical line of treatment to give. And secondly, it is a viral infection. The worst thing which you can do to yourself sitting at home is to self-medicate, either with irrational use of antibiotics or with combination antipyretics, which often contain medicines which damage the blood counts and platelet counts.
You're giving advice to patients. Let me though look still at the public health system first before I come to private health care. Dr. Jaiswal, you are on the governing body of All India Institute of Medical Sciences, the country's top hospital. It doesn't have a separate ward for H1N1. When our reporter went, this is what they were told. A senior doctor of AIIMS said, people come from all over the city and the country. Even private hospitals have separate H1N1 wards. We do not have one at AIIMS. Now, if this is the condition in the country's premier hospital, what do I expect in other hospitals of the country? Should AIIMS not have a separate ward for H1N1 patients?
See, there are so many things which has to be tackled by AIIMS. By the way, I am not the governing body of AIIMS Delhi. I am in the governing body of AIIMS Patna, and I am a member of parliament. The thing is that it is a cause of concern, but panic doesn't make any solution. As the doctor has correctly said that most of us, maybe
but it's your government,
myself,
Gujarat government is, you know, for example, the Gujarat government is a BJP government that has panicked. You know, and it's not just BJP governments across the country. The kind of messages that are going on does suggest an element of panic.
But it doesn't require us to be panic. It's the last time when it was really severe was in 1905. I'm MD in medicine also. I can tell you that time roughly 5 crore people died with that. After that, influenza is such a common thing. Whenever a person was having cough, cold and fever, there was again influenza.
So do you agree that governments need not impose section 144? That's an overreaction?
It's entirely not needed.
It's an overreaction.
It's an overreaction. What is needed is that we should advertise it properly in all the newspapers, all the TV channels. That if you have got cough and cold, then you should stay
This
at
despite
home.
the fact that one former chief minister, 8 trainee IPS officers, many doctors treating H1N1 are reported to be infected by the virus. All of you are saying don't panic, don't declare it a national emergency.
If we get tested ourselves, most likely I and you both will be having H1N1 positive. It's not a big deal. Anyone can have a limited infection because we didn't have fever, we were not bedridden. So it doesn't mean that we haven't contacted with the H1N1. Otherwise, if you see the data which you are telling on your television, it shows that Bihar and UP doesn't have any H1N1. Now, is it possible that an infection, that too a viral infection which is all around, it's in Bengal, it's in Orissa, it's in Delhi, it's in Punjab, it's in Rajasthan, and the Uttar Pradesh is having zero infection.
Let me come to that map. I'll keep showing the map across the country to give you the where exactly in the country the virus has spread. Before I come to you, Dr. Bagai, let me come to you, Dr. Amiben Yagni, because as we said, Gujarat is the one state that has imposed section 144. 242 people have died. The Congress party wakes up today in Parliament. Ahmed Patel, your leader from Gujarat, tries to corner the health minister, saying the government is not taking it seriously. My guests on the panel are saying the government can do no more. This is a virus which doesn't need, which beyond the point, government intervention will not help. So why politicize it?
No, there is no question of politicizing. A question was asked in the Legislative Assembly also that why no patients are given treatment in hospitals, private hospitals. We have 300 primary healthcare centers, 1,127 community health centers, 67 government hospitals, yet patients do not get medicine nor treatment. The answer in the Legislative Assembly was that almost about 60% vacancies are not filled for medical staff and doctors. Where do these people go? That was the question. And don't bring Congress and politicization. We as a constructive opposition party, we did put a question. No, we put a question because the tall claims are made that Gujarat is a very developed state. What happens to the healthcare services, medical services? What happens to the public systems? And where is the management of public healthcare services when such a disaster strikes? You have not declared it as an epidemic. You don't want to give these services through private hospitals, and you say don't panic. There are no medicines, there are no staff. So a question was posed in the Legislative Assembly, and this is the answer that is given by the health minister. So the question is there that Gujarat is a very developed state, has all kind of healthcare systems in place, highest medico-tourism. Then why is it having 3,527 cases as on date?
Can I
144 CRPC?
Can I offer
144 CRPC is not going to help.
No. Can I offer a suggestion?
You have to give treatment.
Can I offer what many believe is the problem in the system? And Dr. Bagai, you can take it first, and then Dr. Shetty. That we have in this country a weak public health system and an unregulated private health system. Many of our reporters, when they've gone to private hospitals, are being told by patients that pathological labs are charging exorbitant fees for conducting diagnostic tests. Chemists have already begun hoarding or black marketing essential drugs like Tamiflu in tandem with private doctors, and therefore you are putting the burden of handling the swine flu outbreak on the already overburdened public health system. So even in a state like Gujarat, which has a relatively better public health system, the system is beginning to creak and crack. So is the private doctors exploiting the situation as well?
No, not really. In fact, in my own clinical practice, I rarely have asked for an H1N1 lab diagnostic test.
But there may be others. This is what our reporters are telling us. They're going to private hospital. Private hospitals are taking advantage of the situation.
What I would like to state is that all fevers are not influenza. All influenzas are not H1N1. Even if you have H1N1, the way to treat is actually not to treat. Again, I state the way to treat is not to treat. You do not need medication for H1N1. You need good hydration, you need hygiene, and you need good
so
nutrition.
So therefore the private hospitals
isolation.
who are asking patients to go and take these tests are effectively exploiting the patient's sense of concern and worry.
Not exactly true, because I in my own practice have seen patients who voluntarily go and get this test done on their own without a doctor's prescription. So what my advice again would be as a carry home message is do not use Tamiflu irrationally. There is no need of antibiotics. Vaccines are only used for a very, very few restricted niche segment of population of healthcare workers. There is no need to panic. All patients with fevers do not require these laboratory and expensive tests.
You know what we found though, and we found this, Dr. Shetty, is a number of people are coming in from neighboring states to Delhi. They are coming in from neighboring states to Mumbai because they believe in the district's facilities are not good enough. They come and the health system in the big metros is also creaking. As I said, there's an unregulated private healthcare system and there is a creaking under-financed public health system. Is that being exposed every time there is an epidemic of the kind that we are witnessing at the moment?
Rajdeep, I agree with you that the public health system is under stress. There is no doubt about it. Because the absenteeism, especially for the specialists in public health system across the country, especially community health centers serving the working class and poor people in rural India, vacancy goes up to 75%. That is mainly because we simply don't have that many specialists. We don't have that many specialists because we don't have PG seats to train that many specialists. We have 50,000 undergraduation seats and only 14,000 PG seats. And this can never be addressed either by the government or the private sector unless they equalize the UG and PG seat. That is a fundamental question. It may not have much to do with the swine flu, but I agree with your view that the public system is under tremendous pressure because simply there aren't that many specialists to take care of the basic needs of healthcare in India.
You know, this debate will go on for a long time about public healthcare system. The figures that I have is the government currently spends what 1.04% of its GDP on health. The national health policy of 2002 had targeted to increase it to 2% of GDP. Now the Modi government is talking of a potentially achievable target of 2.5% of GDP. Is this simply too little? And it's getting exposed every time. I'm not trying to suggest only in the case of swine flu. We've seen whenever this country has faced other viruses as well. Do you concede that, Dr. Jaiswal, as someone who's now a member of parliament, we spend far too little on healthcare?
It's too little. I've raised so many times in the previous government and in the parliament also. I was in the standing committee of health. We have raised it.
What happened? It was UPA. You tell us what happened. You are in the standing committee on health. Please tell us, why does the government not respond to this?
UPA too they have promised that they will make 2.5% in 2012, but they failed it miserably. We didn't have any increase in the health sector. Now this government has promised in 2019 2.5% by 2019.
It's still too little. It's still way too little.
It's too little, but you should think that within 5 years it's 2.5% of the current budget. First thing.
Yes.
Second, we should support private-public partnership as much as it's possible. About actually this swine flu, I want to stress one point also, because people should not be so much relaxed. If you are diabetic who is uncontrolled, if you are having any kind of tuberculosis, or you are having any kind of chronic lung diseases, or if you are immunocompromised in any sense, you should take special care on this at this time, because if you get infected, it will be a great problem for yourself. So it's my request that these population should take special care, and if they get contact with cold and sneeze, they should go to the medical practitioner, and they should take a medical advice as soon as possible.
You know, the fact is this started in Telangana at the fag end of 2014. Now it has spread to areas as far as Leh, in Jammu and Kashmir, to Arunachal Pradesh. Amimben Yagnik, do you believe that the government has failed to localize and quarantine the virus at its origin itself? Are you going to blame the governments now for this? Or do you believe this is, this has happened when the UPA was in power? Let's be clear. Swine flu knows no political parties. 2009-10, we had a swine flu virus which claimed an even larger number of lives. Your party was in power, your government was in power. But the arguments that I've been hearing today in parliament were that why didn't the government quarantine the virus and localize it? Now that could be raised even with the UPA. So I come back to it. Can we go beyond politics when we look at health?
Yes, yes. No, we are not doing any politics on this. You are right that swine flu has afflicted earlier also. But when this government is boasting, I am talking of Gujarat specific, when you boast that you have medical tourism in the state of Gujarat, and when you cannot cater to the needs and the medical services of the rural poor, there are no doctors. So we are just raising an issue that where are all these appointments? Why are you not having the funds or the budget for them? Why are you not catering to these medical health services? There is no question of any blaming anybody. But this government has made very tall claims, and it said that it cares for the people. It wants to do something which the earlier government has not done. So this is the time, and you can't send a message that don't panic. There is panic. People are not getting ventilators. People are not getting admission to private hospitals. So there is a question that what are you going to do to stop this, or to see that the people get medical healthcare services. There is no blame game here, but it is time that they try to work out for themselves that they are going to be a better government than the earlier governments.
You say it's very interesting, there's no blame game, yet you are questioning what the government of the day in Gujarat is doing. But the fact is, Dr. Bagai, that there is a sense when outbreaks like swine flu or SARS occur, the private sector withdraws into a shell in this country. Again, our reporters are reporting that patients are being denied admission in some private hospitals on the pretext that we don't have isolation wards. Many believe it is the fear of losing medical tourists. The point which Amiben Yagnik is making, a state like Gujarat has a flourishing medical tourism sector. Other states also now today have that. Is there a fear that our private sector is simply not up to the challenge? We've accepted that the public sector is underfinanced, but even the private sector not up to it when it comes to swine flu?
There are two aspects to your question. One is that the private sector is completely geared up to manage these kind of infections. Having said that,
it is geared up?
Completely geared up, but having said that, there have to be proper isolation wards and rooms for these kind of communicable infections. The second point which I would like to make with regards to this swine flu H1N1 is that this is now pan-India, and it has been there since 2009. This actually is called as a community-driven now infection. So the virus actually has gone into the deeper roots of the community. Over a period of time, there is a concept which is known as a herd immunity. So a large patient base volume is going to develop a natural immunity towards this infection. That's the reason I'm saying simple precautions and no panic.
Okay, simple precautions, no panic is the message that we are getting from our panel today. We focused on this, and we will continue to focus on issues of public health and education here on the news today at 9. There will always be the noise of politics, but on this program we will try and go beyond that every possible opportunity. Dr. Devi Shetty, Amiben Yagnik, Dr. Jaiswal, Dr. Bagai, I appreciate your joining us on our talking point tonight.